Hello and welcome back. Today we're here with the beautiful, stunningly beautiful, inside as well as out, Dr. Angie Sadeghi. Thank you so much for being here with us. So you are one of the most sought after gastroenterologists, a physician, and also specialize in weight management. Please tell us a little bit about yourself and your journey in becoming one of the most influential plant-based doctors today.
You're so sweet. Thank you so much for that. So I was a vegetarian for the longest time, for like 15 years. And I became a vegetarian because I was in residency and I was sitting down with one of my co-residents at USC. Her name is Sarah. She lives somewhere here in Hollywood. And I looked at her plate and she had this colorful plate full of vegetables. And I looked at my plate and I had a piece of meat. I had a burger and fries, and she always looked good and I was overweight. So I looked at her plate and I said, "Hey, Sarah, what are you eating? Where's your meat?" And she looked at me and she says, I don't eat meat. And I thought, one of those. And I thought I was just going to come up with some slick comment and make fun of her. And I said, "Well, why not?" And she said, "Well, I love animals and I can't eat animals." I mean, she said that I had a pet, as a person who loves animals.
Yeah.
About 15 billion thoughts went through my head in a split second, thinking, I am such a hypocrite. I can't be eating animals and claiming that I'm an animal lover.
Good for you.
So immediately at that moment, I decided that I was never going to bite into another animal flesh ever again. And I finished my burger. I didn't waste the meat. And I never had another piece of meat ever again after that.
Wow.
But I didn't, as you know, nutrition is not discussed in medical school or residency. The focus is pathophysiology, pharmacology, how to band-aid treat everything, how to save people from car accidents and things like that. It's not about preventing disease.
Right.
And nutrition plays a very small role in our overall teaching. So I went on eating a vegetarian diet, not knowing about the deleterious effects of dairy, which is probably even worse than meat if you think about it. And I kept on eating dairy products and I was sick. I had really bad eczema. As a feminine female, I always cared about my appearance, obviously, but I could never achieve that look that I always wanted. I wanted to have beautiful skin like yours. I wanted to have no acne. I didn't want to have pustular eczema all over my hands. I didn't want to feel depressed. I didn't want to be overweight. I didn't want to have high cholesterol, yet I did have all of those. And I worked out really hard my whole life. I've never not worked out. I was a figure skater. I was a swimmer. I competed competitively in high school swimming. I was a figure skater in college. I have always done weightlifting, right? So I was like, well, what is going on? Why am I not in the best shape ever and have body fat percentage of 12% after working out this hard, right? Little did I know nutrition is everything. And when you're eating foods like dairy that spike your insulin and contribute to obesity, what do you expect? I'm eating cheese pizza, for God's sakes, So I went on doing that until 5 years ago when I was talking to one of my cousins who is a musician here in Hollywood, and she's vegan. And I bragged to her, I haven't had meat for 10 years at the time. And she says, well, good. And I said, I just can't imagine these people who eat meat. It's terrible for the animals. And she says, well, I have to tell you something. And I said, well, what? She says, well, the dairy industry is far more cruel than the meat industry. I'm like, what? I'm like, can you say that? I was like in disbelief. I'm like, how is milking a cow cruel? So she opened my eyes to that and skipped forward. At the end of the conversation, she said, have you ever heard of this documentary called Forks Over Knives? I'm like, no, what is that? And she says, well, as a physician, I think you should watch that documentary. So I said, okay. And I'm one of those people, like, I don't seek advice if I'm not going to do something about it. So that night, I went home, Netflix, watched Forks Over Knives.
Is it still on Netflix?
It is. I think it is.
Check it out,
yes.
Forks Over Knives.
Forks Over Knives. It's the best documentary. And I realized for the first time in my life that you can reverse coronary artery disease by eating a plant-based diet.
Yes.
I'm like, no one had ever told me about that. Like, what the heck? All I knew is you get put on statin drugs and aspirin and aggressive measures like put a stent in the heart and this and that. And at the time I was like, what? Is this for real? So then I decided, well, I can't be selfish about it and hold this information back. So, so even though I went vegan for the animals, I realized there are so many nutritional benefits. And as a physician, I can be such a big voice for this movement because it's a multifaceted problem, isn't it?
Yes.
And it takes a multidisciplinary action to fix this issue. There's an environmental problem, there is a cruelty issue going on, there's a health problem going on, and by avoiding animal products, you can have basically this multidisciplinary problem resolved.
How does the digestive system work? How does it initiate? What's the process? And when does it stop and rest? How does the whole process work step by step?
Such a good question, and it basically gives me a chance to tell you a little bit about the overall digestive system. So the digestive system includes mouth to anus. It's a very tortuous tube, and it's basically, it starts from the mouth, esophagus, stomach, small intestine, large intestine, and it also includes the liver, which is like the junkyard of the body, detoxification, storage, and things like that, and the pancreas, which produces digestive enzymes in your small bowel to digest food, absorb food, and finally it goes through and it makes stool, and then you expel. So the digestive system is basically a very brilliant system. I mean, you think about it, the body is able to process all this food and basically absorb all these nutrients and digest the food that you're eating and excrete food. But you know, the most amazing part of the digestive tract comes now. Okay, it's not liver, it's not the pancreas, it's not the mouth, the stomach, the small bowel, or the colon. Imagine this. Recently, we have found that there are 100 trillion gut microbiome that live in a symbiotic relationship with us in our GI tract from mouth to anus.
That's amazing. Which
have so much more to do with the digestion of your food than the pancreas, the liver, everything else combined. That's incredible. And up until just recently, we thought, well, it's just a tube. That's just a tortuous tube you eat and things go through and it comes out as feces. No, there's so much more to that. In fact, we only have, as human beings, about 17 digestive enzymes that come out of the pancreas to digest food.
Wow.
in the small intestine. The majority of digestion occurs because of these little guys, the gut microbiome, living in our gut. So that's where it's fascinating, and that's where nutrition becomes key in keeping a healthy digestive tract.
Nice, nice. And then when does it rest? Obviously when we're not putting in food. And is it when we're sleeping specifically? Is it when we're meditating? Is it when we're fasting? When can we give it a rest, and when should we give it a rest, and how long?
Yeah, I mean, that's a really good question. And, you know, I've always wondered about that myself. I've asked my friends who are gut microbiome experts, I've asked, what is the half-life of the gut microbiome? In other words, if I fasted for 10 hours, am I killing off the gut microbiome? What if I fasted for 20 hours? Would that kill off the guys? Because they're eating what we're eating. So I was trying to approach this question by evaluating the gut microbiome, the most important guys living in our body, which contribute to more genetics in our body than our cells, entire body of cells put together. So no one knows the answer to that. Now, if I were to, I eat for the gut microbiome, literally. That's how I know if I should eat. How much fiber should I eat? Should I eat fats, like saturated fat that suffocate your arteries and ruin your gut health? Should I eat cholesterol? Should I eat, how much fiber? How many fruits and vegetables should I? So I eat for the little guys, right? So keeping that in mind, I was trying to approach that question based on their lifespan, and I couldn't have an answer. There was not enough science to say. But, you know, if you think about the natural rhythm of the human body, we're not supposed to eat in the middle of the night. We're supposed to sleep and give our body and digestion rest. During the day, I believe it just depends on how athletic you are. I mean, you're, for example, very athletic. You are burning through glycogen stores all the time. So if you went fasting for long periods of time, would that affect your training? It could. My friend Dotsie Bosch, Olympian, she goes on these long rides. And what if she went fasting? What if she had 0 carbs in her? How would that affect her riding?
Has she ever fasted?
I don't know. It's a good question. I would love to ask her one day.
She's saying no.
She doesn't fast. You know, what do athletes need? They need carbs because, I mean, the funny thing is you ask athletes, most of the time people go, how much protein do you eat? You know what most of these athletes worry about is, Do they have enough carbs? The energy source. I ask my athletes, how much glycogen stores do you have in your body to sustain that bike ride or that run? You know, that's what's important. It's not the protein that's important. That's what gives them the energy. So people ask the wrong question all the time. How much protein do you eat? You know, and so, you know, for me, I just think that it just depends on your training. If you're training hours and hours a day, I wouldn't fast. I think that would inhibit your training. Yeah. So as someone, I'm a fitness enthusiast, I don't fast. But I also know of some places, like Dr. Clapper is into fasting, but you have to realize his patients are patients with metabolic syndrome, with morbid obesity. If you look at his select patients, they have medical problems, and he puts them on a fast, and he's had great success. So I think when it comes to fasting, there's different data and there's different ways of looking at it.
What is gastroesophageal reflux disease, commonly known as GERD, and what do you recommend to your patients who have it?
So this is a very good question. Thank you so much for asking, because there are millions and millions of people who have gastroesophageal reflux disease, which manifests as heartburn or reflux of acid into the throat. They get sore throat, coughing, abdominal pain. Basically, they can't sleep at night because stuff comes into their throat. They start coughing and choking and things like that. So it's a really big problem in the United States. And about 3 out of 5 people report an episode of gastroesophageal reflux.
Wow.
And that's what has led to the multi-billion-dollar industry, PPIs and H2 blocker medicines like Prevacid, Esophagus, Nexium, Zantac. I mean, I can go on and on, right? So it's a big problem. And from what I see, what happens is most people blame acid. So they come to me and they say, oh, I can't even look at tomato sauce without getting acid. And I've given up oranges and lemons, and I've given up tomatoes, and I still have it. What do I do? Well, let's think about it. Acid is important in the stomach. That's where it belongs, people. Hydrochloric acid, when you look at food, you smell food, you think about food. Just talking about food right now, I just had hydrochloric acid sprayed in my stomach. So what? That's normal. What becomes pathological is when you have gastroesophageal reflux, which means the lower esophageal sphincter of the esophagus relaxes and allows this acid to come up into the throat. That's a problem. Why? Because as much as the stomach is well equipped to handle acid because it has a protective mucus layer, the esophagus doesn't. The esophagus is supposed to be a pipe to transfer food down into the stomach, and that's about it. It's not well equipped to handle acid. So when the acid comes up, it destroys the esophagus. You won't be happy because it's going to hurt your throat, vocal cords, and all that stuff. So then where's the problem here? Why isn't the tomatoes, if lemons are okay and tomato sauce is okay, then what's the problem? Well, that acid is not going to hurt. What hurts is when you eat fried fatty foods, that lower esophageal sphincter gets loosened through a hormonal thing I'm not going to go into. That sphincter loosens and allows this acid to come up. So as long as you have this acid in your stomach, it's not gastroesophageal reflux until this acid comes up into the throat and causes havoc. So what do I do with my patients who have gastroesophageal reflux disease? Do I put them on a PPI right off the bat? No. I ask them to stop eating dairy. That's the first step.
They're very lucky they have you as a doctor.
Well, thank you. I'm saving them from a lot of problems down the road. So what's wrong with dairy? Well, it's very fatty. You know, you eat cheese pizza. Is it the tomato sauce that caused the reflux, or is it the cheese? So it's very easy for humans to think, oh, I had that pizza, so then it's the tomato sauce. But if you think about it, it's the fat in the cheese that's causing the reflux, right? So what I do is I ask them to avoid all dairy. They come back 99%, they're better. Sometimes you have to also cut out other types of fats, but that's the first best step, because the fattiest thing you can consume is probably cheese and other dairy products. So there are a very small percentage of people who go on to have problems. Then you have no choice but to use these PPIs and H2 blockers as needed. But dietary modifications and lifestyle modifications are key in preventing GERD and basically reversing the symptoms.
What are your thoughts on intestinal and colon cleansing methods like colon hydrotherapy, enemas, or parasite removal supplements? Do they work, or can they be harmful?
Very good question. I get this question asked all the time. So the way it turns out, the colon is supposed to be dirty. In fact, it's the dirtiest place I can think of. If I were to swipe this right now and did a microbe analysis on it, it won't be as dirty as if I swiped your colon. But guess what? As human beings, we have to understand that parts of the GI tract are supposed to be dirty.
Yeah.
And it's okay. Same with the vaginal tract. There's microbes there that are helpful. So this whole colon cleansing thing has been a ritual for many, many years, hundreds of years, and it doesn't make it right and it doesn't make it healthy. We just have to understand that. So when you do a colon cleanse, what you're doing is you're wiping out the beneficial bacteria that are there. So when people have constipation, they feel super bloated and uncomfortable. So the first thought is, well, I'm just going to get a colon cleanse. But remember, you're Band-Aid treating it. Yes, you evacuate, but then what? What are you going to do next? You're going to go back to the standard American diet, be constipated again. So what are you going to do? Colonics every day and kill off your gut microbiome and perhaps risk getting a perforation, which is a tear in the gut. I mean, it's not worth it, everyone.
Can that happen with hydrotherapy?
It can. It can. If you have pockets called diverticulosis and you push up the water in there, it could perforate. So it's a bad deal.
Yikes.
And so
what happens in that instance?
Well, it becomes an emergency, medical emergency, where you have to go to the hospital and they have to cut the colon out or that part of it. Yeah, it's a big deal. Yeah, it's not too. I would never, ever, ever do that hydrotherapy procedure.
Yeah, it's always scared me. I mean, it's big in the vegan community too, especially with raw vegans. I'm like, you're getting a lot of fiber. You're evacuating a lot with your diet.
And
why do you
that's it. You just said that. You're getting a lot of fiber. To me, that's nature's colon cleansing method.
Yeah. What is small intestinal bacterial overgrowth, commonly known as SIBO? What are the symptoms and how do you treat it?
Very good question. And there's so much that we need to learn about SIBO. But SIBO is small intestinal bacterial overgrowth, as you mentioned. And it's basically an overgrowth of bacteria in the small intestine, basically more bacteria than needs to be in that area naturally. So it's mostly the colonic type bacteria that grow in the small intestine. And when the populations of the bacteria increase, that leads to gas and bloating after you eat. Shortly after, so people with SIBO have a lot of bloating and gas, abdominal distension, and they wake up okay with a flat belly, but as soon as they eat something, they produce a lot of gas and bloating and they look pregnant. And it's very common and it's very bothersome and it lowers the quality of life for so many people. So basically, the question is, when it comes to SIBO, is what led to SIBO? And you have to dig deep. Perhaps somebody had celiac disease. So there's got to be an underlying etiology for it. So as a physician, one has to look into it further. Perhaps someone is taking proton pump inhibitors for GERD that lead to SIBO because you're reducing stomach acid. Perhaps someone had surgery, maybe bowel surgery, that could cause it. They were on, I don't know, maybe they were just so overzealous and took gobs of probiotics or something. I mean, something led to this overgrowth. And so there's more bacteria living in there. So when you eat, what happens is this bacteria gets a hold of this food and ferments it. Through process of fermentation, releases gases like CO2, hydrogen, or methane gas, and that gas gets trapped in the abdomen or in the small intestine and causes distension. So that gives you that bloating feeling.
Okay.
So so the treatment is to hopefully be able to take away some of these foods that could cause more overgrowth. So there is a popular diet out there called the FODMAP diet. I don't know if you've heard of it. Yes,
but my best friend has colitis, so we've talked all about all of this stuff.
Yes,
over and over and over again. So I've heard of it.
Yeah. So the FODMAP diet came out a couple of decades ago, and they said, well, if gas comes from fermenting carbohydrates, why don't we just take away all these fermentable carbohydrates and problem solved, right? Well, at the time, it seemed like a good idea. I even back then jumped on the bandwagon and I told all my patients, well, don't eat the fermentable carbohydrates, you're going to be fine, Yeah. But it was a Band-Aid therapy. It turns out that by doing so, at the time, I didn't know, you are eliminating prebiotics and fiber-rich foods that feed the good gut microbiome. And so you're basically taking away the food from the gut microbiome, decreasing gut microbiome diversity, and that leads to basically worsening of your gut health, right? So if you have SIBO, if you're listening and you have SIBO or IBS, do not do the FODMAP diet. I basically instead started doing this with my patients, and I'm going to share that with you right now. I went on that list of the FODMAPs and I go, which one do we not need? Oh, good, it says lactose. I'm like, why would we want to eat lactose? Don't need that. Okay, stop. Look, don't need the lactose. Take that away. I agree with the FODMAP diet. The lactose is not good. Then I went down the list. Honey, totally basically useless. No nutritional value. Okay, don't need the honey. And fake sugars and refined sugars. Okay, no nutritional value. All right, so this is what I told my patients. So I was like, simply avoid refined carbs, honey, and the lactose and dairy products. Lo and behold, it's been the most successful thing I've come across on my own. And I realized that those were the items that in the FODMAP diet were actually helping people tremendously. So why would I take away all these other good things included in that diet when I can just avoid these other ones? And my patients did really well. So that's the secret.
Nice. I feel like that's the same thing with like the paleo diet. Everybody takes out the highly processed foods and then they start to feel better and
Yes.
they say, oh, well, I can still eat meat. Well, you could eat a whole food plant-based diet and thrive even more.
Absolutely. That's so well said.
What are candida and leaky gut, aka dysbiosis? What are some symptoms and what foods help with healing?
So dysbiosis and basically candida and so dysbiosis is generally referred to as basically an imbalance of gut microbiome, and leaky gut is also included in that term. Leaky gut is not actually a medical term. It's something that's all over the internet, and it means basically. So let me go back.
Yeah.
The bowel cells are called enterocytes. Enterocytes are connected together via tight junctions, these bonds. So let's hold hands. This is a tight junction. I'm a cell, you're a cell. When this breaks off because you're eating dairy or meat, what happens is leaky gut. Why? Because now there's a hole, there's a gap between us, and here's the bowel, here's the blood. So this is supposed to be the barrier between the bowel and the blood. When that tight junction breaks, it becomes leaky. So anything that comes into your gut, including bacteria, toxins from meat, whatever, can come right through into your blood and circulate around. Furthermore, these bad gut microbiomes are sitting here. This saturated fat and all these animal proteins are coming down, right? They get a hold of the animal protein and they pump out something called TMA, goes to the liver, becomes TMAO, and it wreaks havoc on your system, causes metabolic disorders and coronary disease, right? So that's what leaky gut is. That means the protective mucus layer of the gut is gone, the tight junctions are broken, and there's direct link between the blood and between the gut and the blood.
Wow.
So dysbiosis could mean that, as well as an imbalance of the bacteria. For example, you have overgrowth of candida, or you have overgrowth of certain bacteria. So there are 100 trillion gut microbiome, and they could include viruses, bacteria, or fungi. And so candida is just one of them. Okay. And you can test for these things. Another thing that contributes to health, which you asked, to how do we keep our gut healthy? Well, besides avoiding animal protein and saturated fats, another thing is have plenty of fiber, because that mucus layer that's sitting there protecting our cells, it's basically it's there for a reason, right? If you starve your body and not eat enough fiber, the gut microbiome that require eating fiber as food, they start self-digesting. What that means is they start like eating the mucus layer as food. You're not eating enough fiber, where are they going to get their food from?
They're hungry little creatures.
They're hungry little creatures, and they need to eat. Absolutely. So what happens when you start going on these low-carb diets, like the keto diet? You're not getting enough fiber. These guys are going to get a hold of the mucous membranes and just kind of eat those up and expose the gut to basically damage. And then you're eating all that saturated fat that breaks the bonds. So that's where it really basically makes you prone to inflammation and diseases and allergies, food sensitivities, and all of that stuff.
Do medications like antibiotics disrupt our good gut bacteria, and can they cause irreversible damage after large amounts?
Absolutely. When you take a non-selective, a broad spectrum antibiotic, you can get rid of as much as 60% of the gut microbiome in the gut.
How long does that take?
It's probably within a few days. You are diminishing the population of the gut microbiome. And it's very important not to take broad spectrum antibiotics for simple little things such as, oh, I just have a cold. Oh, I have a little sinus infection for 2 days. Or I have a little sore throat. It's really important that you let your immune system fight infections and not try to intervene by taking these antibiotics, because the antibiotics are broad spectrum and they kill off all the bacteria, including the important gut microbiome. And that actually causes more problems than you can imagine. There is a bacteria called Clostridium difficile. And as long as you have a good population of gut microbiome, this bacteria doesn't get activated and cause disease. But in patients who take antibiotics, what happens is they kill off the good microbiome, and the C. diff can get strong and start becoming, causing pathology in the gut and colitis. And so people get bloody diarrhea, fever, full-blown infectious colitis, and it can be a medical emergency. So, and the treatment for it is a certain type of antibiotics that kill off the bacteria or stool transplantations, which replenishes the gut microbiome balance. But so it's really important not to take antibiotics if at all possible.
Now, is there hopes? So I was on antibiotics for a really long time at one point in my life. And did I do irreversible damage? Do people do irreversible damage that say their doctors give it to them for months at a time?
Sometimes, yes. And some people get lucky. Some people get lucky and nothing bad happens, nothing noticeable or clinically evidence. But then some people come to my clinic with horrible gut problems because they took antibiotics or they basically had taken multiple rounds of antibiotics for very long periods of time. So, I mean, you can imagine in the past, people would have acne from eating dairy, and what would we do about it? We would put people on antibiotics to clear the acne, when the real cause of the acne was the dairy. So it goes back to figure out why.
Right.
Figure out why. Is it diet? Because if it's diet, hey, take away the offending agent instead of throw antibiotics at it.
Right. Let's touch a little bit on fecal transplants, because you mentioned that. What is that? And let's just touch on it for a minute.
So fecal microbial transplant is, in my opinion, as important as the antibiotics that came out, which were life-saving. And now we are finding so many therapeutic implications for fecal microbial transplant. But in English, what FMT is when you take the stool from hopefully a plant-based donor with good diversity and a healthy microbiome balance, and you transplant it in somebody with some kind of a disease. For example, C. diff, and that's what it has been approved for so far, for treatment of C. diff. So you transplant this gut microbiome in an unhealthy gut and restore the balance, and immediately people get results. I'll give you an example. About 5 years ago, when the fecal FMTs were just coming into fashion, I was working at the hospital, and I had a patient who was literally dying from C. diff, and she was failing all medical therapy. We had her on vancomycin, metronidazole, rifaximin, all these antibiotics to try to kill off the C. diff, because she had been on antibiotics for pneumonia, and she was going to die if she didn't get the antibiotics. So we had no choice, but then she got C. diff. And so then we had her on all these antibiotics, and she was septic and on really powerful drips, pressors to keep her heart going, and she was on a ventilator. And I gave her an FMT, and back then, like, no one knew about it. I was like the first person in the hospital who introduced it to the hospital. Back when I was working.
That's amazing.
I know. I talked to everyone, and I'm like,
surprised they let you do it.
I know. They're like, what are you gonna do? I mean, it was just like, whoa. What are you talking about?
How do you do that? Is it a pill you swallow? Do you have to do surgery? Like, how do you do it?
Well, back then we would just take a family member who was healthy and test them for HIV, hepatitis, and infections. And if they basically everything is negative, then we'd use that donor. Nowadays, they have actually very stringent criteria, and they choose donors who are mostly plant-based and eat tons of fiber, and they don't drink, they don't smoke, they have all these healthy habits. And so they have banks now for this. But back then we used
poop
to before, poop banks. That's exactly what it. The open biome in Boston, actually, they only take vegans, and you know it's really hard to actually
if you're a vegan in Boston, there's a job offer.
You can make like $40 a poop.
Wow.
Yeah. So like a lot of people are actually, once you make it as a donor, you can repeatedly donate. So it's actually pretty cool.
How did they get it into the person who needs it?
Right, so there's different ways. What you can do is take, for example, back when I was doing it, I would just literally, it's really easy. You just mix it with some saline, mix the stool with saline, and spray it through the colonoscope. So when you go inside the colon and spray it into the colon, or you could put a nasogastric tube and push it down into the small bowel and release it there, and it goes through the GI tract. And now they have capsules for it. So there are so many different ways of doing it, but the point is to get that stool into the GI tract.
That's amazing.
I know. But going back to that patient, it's really funny. As soon as I gave her this transplant, it was like, I didn't even expect it. I thought, oh, she's so sick, and I don't even know if she's going to make it. This is last resort. I talked to the family. I'm like, I don't know about this. I'll just try it. And they're like, okay, what other options do we have? I'm like, pretty much none. Let's do this. So I did it, and it was amazing. Within 30 minutes, she came up off of one presser. 30 minutes later, another presser came up.
That's fast.
Literally, like, her blood pressure sustained on her own, and her heart rate normalized. And within a few hours, she was like a different person. And the next day, the ventilation tube, or the tube, the breathing tube came out, and she left the hospital like a few days later, totally fine with that one stool transplant. So it's miraculous what it does.
God bless you for speaking up and giving that to her.
Yeah.
Wow.
Thank you.
What is the difference between IBS and IBD? I know we touched a little bit on colitis. What foods do you see help your patients get into remission and stay there?
So IBD is inflammatory bowel disease, and that is basically an actual inflammation process in the gut, where the gut is getting destroyed by the immune cells. It's like an autoimmune type disease where the body is attacking the gut wall and causing damage and inflammation. Irritable bowel syndrome, it's the worst name. It's not like inflammation like you would see in inflammatory bowel disease. It's not colitis. It's a bad name. Irritable, I suppose, because people are very irritated when they have it. Bowel syndrome, I don't know who came up with that name. It's not the best name, but all right, we're just going to roll with it because it is what it is.
Yeah.
Irritable bowel syndrome. It's not an inflammatory process. And we used to have so many theories as to what causes IBS, and is it stress? Is it nervous people? Is it people with anxiety and depression? And now we're questioning all of that. So people get abdominal pain, either and bloating, either constipation or diarrhea. Some people have either diarrhea or constipation. Some people have alternating constipation and diarrhea. It's a bad deal. It's really horrible. People have like urgencies, and they have like 15 bowel movements a day. But this whole IBS thing has been very interesting. I read about it, and I hated it because there's really you can't do anything for your patients. You just Band-Aid treat the abdominal pain with some Bentyl. You Band-Aid treat the diarrhea with some Imodium. You Band-Aid treat this and that. And at the end of the day, you feel so bad about yourself because you didn't do anything for the patient. But, it's funny because I've gotten really into treating IBS because I realized half these people who have IBS, who were labeled with IBS, don't even have IBS in the first place.
What do they have?
It turns out they have lactose intolerance.
Wow.
So they've been seen by 5 other doctors, and they're on all these fancy medicines because of their constipation or diarrhea. They come to see me, and I'm like, stop eating dairy. And they're like, oh, it can't be that easy, come on, you know. And I'm like, well, how many consultations have you had? How many MRIs and CT scans and ultrasounds and colonoscopies have you had? Well, yeah, you're right. I've had 2 colonoscopies. Everything looked normal. And everyone says it's in your head. Stop being so anxious. And I'm like, okay, so are you ready? And they say, okay, what else do I have to? I'm like, go home and look at labels and avoid dairy like the plague. Can you do that? And they're like, okay, all right. But then after a month, could I eat it again? I'm like, well, do you want to feel bad again? It's up to you, but let's just test it out. Is there a blood test for it? I'm like, no, stop eating dairy and come back. So they come back a month later and they're like, I'm amazed. So I didn't have IBS to begin with. I say, no, you probably had lactose intolerance. And so then some people come back and they're not better. And then you have to dig deeper. So it turns out that there's just recent data coming. And this is all new, by the way. I mean, we used to treat IBS with like serotonin reuptake inhibitors and anxiolytics and all kinds of stuff. And now we stumbled upon this data. New England Journal of Medicine actually published it. It turns out that overgrowth of bacteria can cause IBS. So now we know that it could be dysbiosis and all kinds of gut microbiome related issues causing IBS. And we call it IBS, but it's actually related to the gut microbiome. So in this study, they put people on this type of antibiotic and they killed the overgrowth and people's symptoms went away. So was it a nervous issue? Perhaps not. And they've done studies on people in the military and they try to associate stress with symptoms, and there's no good data that stress causes IBS because these people who were on active duty, whether they were deployed or not, they were having symptoms. So could stress be causing it? I don't know. I mean, the literature's still developing, but
it's probably not good for it.
It's probably not good for anything, right? But it has to do more with the dysregulation of the gut microbiome. And so then what do you do for it? Well, again, we go back to what is healthy for the gut and what is healthy for the gut microbiome. And the answer is a high fiber diet, even though it causes some bloating at the beginning. You just have to stick with it. You see, the gut microbiome wants to have, the healthy gut microbiome want to eat fiber and prebiotics. And the more meat and dairy you put in there, the worse off you are. So again, when it comes to IBS, avoid dairy because it could be lactose intolerance to begin with. Then start eating a high fiber diet and slowly ease into it and build up the gut microbiome diversity so you can digest the fiber and perhaps the IBS would be gone.
And then what about IBD? How do you get your patients into remission? Same way?
You know, really good question. Actually, I just had a conversation with the most amazing, one of the most amazing women I know, Pam Popper. She's in Ohio.
I like her a lot.
Love her.
Like I could be friends with her from the stuff I've seen, like her interviews or her speaking engagements. I'm like, she's cool.
I want to hang out with her every day.
Yeah, I feel the same.
So she and I were talking, and we're thinking about writing up case reports because she and I. Well, she's been doing it for many years. She started way before me. And one time I binged watched all her YouTube videos and read her stuff. And what she has been doing is she's been putting people into remission who have inflammatory bowel disease. And I was like, I'm going to do that. So I basically brought it into my clinic practice and I decided to let people know, look, this is not standard of care yet, but here's the thing. I have seen success stories out of from one of my mentors, well, people I admire, who've put patients into remission with IBD and she's had great success. Are you willing to comply here? Let's try the diet thing first before we throw all these medicines on you. And you'd be surprised. A lot of people are like, yes, for sure. Because, it's a very desperate time too, and so people agree with it. And so I asked them to go 100% whole food plant-based right off the bat. None of this, we'll avoid dairy for a month or don't eat red meat, nothing like that.
Or even a little oil,
Nothing.
too.
No, we're going 100% whole food plant-based, right? And I set them up with my dietitian to make sure they understand what that means exactly.
Good.
But you have to be careful. You have to add the fiber very slowly because these people get bloated. They don't have the gut microbiome to handle all that digestive process. So I have had great success. I had a woman who was having 15 bloody bowel movements a day. Can you imagine?
My best friend goes through that.
It's horrible.
Awful.
Right.
It's awful.
Poor quality of life. And she went whole food plant-based and she went into remission. I've had people who come in already on medicines. I put them on a whole food plant-based diet and get so much better. So I've had 15 success stories that I can tell you about.
That's
and
amazing.
It was all motivated by Pam Popper, who has been doing this for like 10 years or so, or even longer. And so she and I were talking yesterday, and when she called me, I was like so starstruck. I was like, so excited. I was like, I'm talking to Pam.
That's how I am every time I sit down
Right?
with you guys. I'm like, oh my goodness, I can't believe it's happening.
I feel happy sitting with you.
What are your thoughts on digestive enzymes? Are they helpful, harmful, or just a waste of money?
So usually digestive enzymes are enzymes that come from the pancreas, and they digest macronutrients like the fibers, the sugars, and the fats. So the digestive enzymes initially were developed for people with pancreatic insufficiency. In English, they had a pancreas that's not working due to maybe chronic alcoholism or cystic fibrosis, and so they don't have enough pancreatic enzymes. And so we used to give prescriptions for lipase and all these other enzymes that go in there and do the job of the pancreas. For some reason, they became very fashionable in the supplement industry for people to just pop them for no reason with a normal pancreas. I don't think that's a good idea because I don't even think it's needed. I think it's pretty much a waste of money in most cases, unless you have pancreatic insufficiency. But then you would have to find out why. Why do you have pancreatic insufficiency? Do you have pancreatitis? Do you have cystic fibrosis? Well, then, you may want to stop drinking, or you may want to seek help for your cystic fibrosis. But it's just weird because now it's added to all these supplements. It's a buzzword. And our supplement contains pancreatic enzymes, and it makes it look sexier, I think. I don't know. I wouldn't take pancreatic enzymes for no reason. Why? It's like, always ask questions. Why are you doing it? And if your pancreas is fully capable of producing enough enzymes to digest your food, there's really no reason. So if you're having digestive issues, I have news for you. It's probably not your pancreas. Most of the time, it's the lack of gut microbiome diversity, because most of digestion actually occurs with the gut microbiome. We have, like I said, only 17 enzymes from the pancreas. We have thousands of enzymatic processes that happen, digestive processes that happen by the gut microbiome. So if you're having digestive issues, most of the time, you're probably not going to get any better. The supplement industry is a very powerful, multi-billion-dollar industry. And just because medicines are bad, it doesn't make supplements any better. So you have to be careful not to waste your money introduce these supplements blindly to your body without knowing harmful side effects. Just like the pharmaceuticals, I'm sure these supplements have side effects as well. We just don't know because they haven't been tested.
What are your thoughts on probiotics? Is there ever a bad time to take them? And what are the best pro and prebiotic foods?
So probiotics have become such a multi-billion-dollar industry, and there are so many people purchasing these probiotics randomly off the shelf and they take them. If you ask me, do I take probiotics? The answer is no, because I have a healthy digestion. So the answer is not taking probiotics to improve your digestion. The answer is, why is your digestion not working, and what is wrong with your gut health, and fixing the underlying etiology rather than throwing probiotics at it. So I see people spending $60, $80 a month on probiotics, but then they're eating meat and dairy, which is basically contradictory to the whole thing. So given that fiber is important for gut health, and fiber feeds the bacteria in the gut, the healthy gut microbiome. In order to improve diversity of the gut microbiome and have more of these guys living in your gut, you have to eat a lot of fiber or prebiotic-rich foods which feed the bacteria. So now let's imagine if you have inflammatory bowel disease, or your gut microbiome is pretty much killed off, or you have lack of diversity, or in certain cases, like you took antibiotics and you destroyed the gut microbiome diversity. In those cases, it may not be a bad idea to supplement with probiotics. And in some testing, it has shown that, for example, in ulcerative colitis patients, it makes sense to take these probiotics to improve your gut microbiome diversity. But after you re-inoculate the gut with the probiotics, it's really important that you feed these guys with prebiotic-rich foods, which basically means fiber-rich foods.
Aren't dandelion greens really good source of prebiotics?
Yes, they are.
I love dandelion greens.
Yes.
What are your thoughts on kombucha and fermented foods? and also alcohol's effect on the gut and overall health?
So I believe in eating some fermented foods. I think that perhaps one should not overdo it with kombucha drinks. For example, one could drink perhaps too much, and it could lead to overpopulation of bacteria. We don't have any robust clinical trials to prove that, but I have seen in sporadic cases of patients who are very overzealous, and they're very healthy, and at the same time they drink kombucha and they take probiotics and tons of fiber-rich foods, and sometimes they come in with a little bit of overgrowth. And when I ask them to stop, take away the probiotics, take away the drinks, they do better. So perhaps too much of a good thing can be bad.
Okay. And what about alcohol?
Alcohol is definitely not a good idea. So alcohol is very acidic and it can kill off the gut microbiome. So I see many patients who drink chronically who come in with dysbiosis. And I always ask my patients whether they have reflux disease or dysbiosis to stop drinking, and they get better.
And I know that some kombucha has alcohol in it too. So would you recommend drinking I know there's one it always has like the over 21 wrapper on it. It's like a different kombucha that has more alcohol in it than the regular kombucha. So would you recommend sticking to the low alcohol content
I always
kombucha?
do. I tell my patients that to be honest with you, I would drink kombucha once a month or so. I just drink water, to be honest with you. So I don't, I just kind of feel like, hey, just get as natural as possible.
Yeah.
I don't really have a need to drink all these different, when I get fancy, I will drink sparkling water with lemon.
We were just talking about that yesterday. When there's a celebration, we pull up the sparkling water.
Exactly.
Are sprouting and soaking grains best for digestion?
Yes. So soaking and sprouting can increase the nutritional value. And also it can be easier on digestion because some of these foods have some micronutrients such as phytates, lactates, histamines, and oxalates. And sometimes soaking can help because it just eliminates these types of micronutrients. And some people can get away with eating it and they have the machinery in there to have no problems, but some people can't. So it's really important to soak it, especially if you're new to this whole eating whole food plant-based. It's really important to do that. And sprouting can increase the nutritional value. So yes, absolutely.
And how long do you recommend soaking? Maybe overnight? A day?
Overnight.
A couple of hours?
Overnight is probably the safest.
Okay. And what are your thoughts on honey, maple syrup, stevia, date syrup, blackstrap molasses, and any other sweeteners? What are the best if one wants to have them, and what are the worst for the gut and overall health?
So no, I know. I'm not going to advocate eating sugar as health food, right?
Yeah.
Refined sugars and sugars in general are not good for you. Yeah. Now, if you want to have a vegan treat, I'm not saying I'm perfect. I eat 99% plant-based, but I will have a vegan cheat once in a while that has sweeteners. I'm not saying I'm perfect, but it shouldn't be in everyday. Sugar should not be in everyday food. I don't advocate that kind of eating. And so I would say for the most part, stay away from those things. And if you want to sweeten something, use dates. Because anytime you're using dates, it has fiber attached to the sugar. It's not refined. So the glycemic load is different than if you refine sugar or use these sweeteners. And so my thought is, hey, eat plant-based. And the difference between plant-based and vegan, as you know, is sugar, oil, salt. Yep. So anytime you're adding these sugars, it's not plant-based anymore.
Let's talk brain-gut connection. Do our emotions start in the gut, and do our gut bacteria drive us to eat certain foods?
Yes, absolutely. So the gut is one of the most innervated, organs in the body. It has the second most largest population of neurons, and it is so important. And we found more and more that there's such a huge brain-gut connection, and it turns out that so many of these neurotransmitters and stimulants that cause neurotransmitter production comes from the gut. I'll give you an example. Serotonin is a neurotransmitter that we used to think is lacking or deficient between the synapses of neurons. So if you would give a serotonin reuptake inhibitor and kill the enzyme that gets rid of the serotonin and increase the population between the neurons, we can take depression away. So now the focus has changed to helping with gut health because 90% of serotonin comes from the gut. So
is it 90%?
90%.
Wow.
Yes. So if your question is there a brain-gut connection? Absolutely. So perhaps now the best approach to treating people with anxiety disorders and depression is to improve gut health. And perhaps that could in turn help with mental health as well. And so we're finding out more and more how many of these neurotransmitters are actually produced in the gut. And so gut health is everything. It even helps with mental health.
What tests should people ask for from their GI or PCP to ensure they have a healthy gastrointestinal system? And would genetic tests be beneficial as well?
Luckily, you don't need a doctor to tell you you don't have reflux disease, you don't have excessive bloating and gas, you don't have constipation, you don't have diarrhea, you're healthy. So luckily, nature has it, so you get these red engine light signs that tell you. There are some screening tests, such as if you're 50, you should have a screening test for colon cancer because colon cancer symptoms don't come out until it's too late sometimes. So we do screening tests to look for polyps that can become cancer. So I'm not talking about screening for cancers, but you look for red engine light signs. Like, for example, you have diarrhea or constipation, blood in this. So all those are red engine signs, and you should attend to them.
Literally red engine signs.
Yes, yeah, exactly. And you should listen to your body, and you should seek help and do the necessary testing. But, instead of waiting for problems to happen, this is what I propose. And I know it's hard because a lot of people who are young and they feel invincible, they think, there's nothing wrong with me. I can get away with it. But look around you. Look at your family members. When you're 40, 50 years old, things are going to happen. Things are going to break down. So instead of waiting for those red engine light signs, the best approach is to prevent problems. Eat healthy. Your gut will stay healthy if you give it healthy foods. The gut microbiome diversity will stay healthy if you're eating healthy foods. And perhaps you could prevent all these problems. And when you do go for your checkups, screening for colon cancer, you won't have any polyps or problems.
Yeah. Well, thank you. Thank you for your time, and thank you for being a voice for us, for the animals, for this earth, for our children's children. Thank you for being so special and doing the research and putting the time and work in. And I know you devote your life to this. And I honor that, and I thank you so much.
Thank you so much. I appreciate it, and thank you so much for having me.
Oh, my goodness. Thanks so much for tuning in.
Love Gianna and Dr. Angie Sadeghi.
Oh, okay.
Oh, sorry.
Let's do it again. Thanks so much for tuning in.
Love Gianna. Love
and
Dr. Angie Sadeghi.
Sadeghi.
You want to do one more time? Yeah.
Love Gianna and Dr.
Okay.
Angie Sadeghi. Okay. Thanks so much for tuning in.
Love Gianna and
Dr.
Oh, one love. I'm sorry.
There's so much love in this room. Okay. Thanks so much for tuning in.
Except for yourself first.
Chest and nose. Okay. Thanks so much for tuning in.
Love Gianna and Dr. Angie Sadeghi.
I can't stand it. We say, okay,
Love
so
Gianna and Dr. Angie Sadeghi. Got it.
It's happening.
We can
It's
do
happening.
this.
Okay, thanks so much for tuning in.
Love Gianna and Dr. Angie Sadeghi.